I'm Dr. Tim Swartz, and I'm a fellow with the American College of Foot and Ankle Surgeons, here today to talk to you about pediatric flatfoot deformity. Many people, children and adults alike, have a condition called flatfoot. When you have this condition, the arch on the inside of your foot is lower than normal, which is why some people call it fallen arches. When it occurs in children, doctors call it pediatric flatfoot. Sometimes flatfoot is apparent at birth, but many times it does not show up until years later. If you've been told or if you notice that your child has flat feet, you're probably wondering if you need to have this checked out by a foot and ankle specialist. Here are a few facts that can help you understand more about this common disorder and determine whether you need to be concerned. First, it's important to note that pediatric flatfoot can be symptomatic or asymptomatic. When it's asymptomatic, the child has no symptoms, such as pain or tenderness. But when this condition is symptomatic, the child can have one or more symptoms. Let's take a look at these possible symptoms. If a child has symptomatic flat feet, he or she will have one or more of the following symptoms. An obvious symptom is pain, tenderness, or cramping in the foot, leg, or knee. There may be an outward tilting of the heel. Another symptom may be awkwardness or changes in the way the child walks. Also, some children with flat feet have problems with shoes, such as shoes having pressure points and rubbing against the foot, or shoes wearing out too quickly. Still, another possible symptom is having less energy during physical activity or voluntarily withdrawing from these activities. Parents of children who don't have any symptoms generally don't need to be concerned. But if your child has one or more of the symptoms, it's time to see a foot or ankle specialist who will evaluate your child's flat foot and determine the best treatment. In evaluating your child's condition, the foot and ankle surgeon will listen carefully to the history of when symptoms occur. The surgeon will also examine the child's feet and perhaps knees and hips, observe walking and range of motion, and sometimes order x-rays or other imaging tests. The examination will enable the surgeon to determine, among other things, whether the child's flat foot falls into the flexible category or the rigid category, and this distinction will drive the course of treatment. The more common and less severe form of flat foot is the flexible type. Conservative treatment is typically sufficient for most children who have symptomatic flexible flat foot. A number of conservative options are available. These may include placing inserts or custom orthotics inside shoes to temporarily support the arch, temporarily cutting back on the activity that brings pain, physical therapy such as stretching exercises, and modifying the child's footwear. For rigid flat foot, and for some cases of flexible flat foot, surgery may be necessary to relieve the symptoms and improve foot function. Your foot and ankle surgeon will determine the procedure or combination of procedures that is right for your child. So as you can see, not all cases of pediatric flat foot are alike, and not all cases are cause for concern or require treatment. For more information about pediatric flat foot and to find a foot and ankle surgeon near you, visit foothealthfacts.org, the consumer website of the American College of Foot and Ankle Surgeons.